is Megan Joyce. I'll be your student nurse today. I'm going to wash my hands and I'll put gloves on in a little bit. I have doctor's orders to change your IV tubing. Can you state your name and date of birth for me?
Jillian Bolt, 6/10 of 96.
Great. And Jillian, do you have any allergies?
No.
Alright, the first thing I'm going to do is check your arm for any signs of phlebitis or infiltration at this time. No. Which what I'm looking for is some redness, swelling, or pain at the injection site. Okay, now I'm just going to check the sterility of my packages while I'm here. And the expiration date. This would normally be closed, but I've done this video a couple times. So, yep, this is good, and 2020, not expired. This is nice and closed, and it's not expired, and this is nice and closed and not expired. Now I'm going to do my first check. Oh, God. 0.9% sodium chloride, flush, 10 milliliters. Take this out of the bag so I can see. Oh boy. 0.9% sodium chloride. And that checks out. The next thing I'm going to do is, oh boy. Yeah, I would have checked the expire. I'm going to do a second check, I guess. I already did say. Oh yeah. I'm just going to do my second check real quick. 0.9% sodium chloride injection. A flush, 10 milliliters, yep. And 0.9% sodium chloride. Yep. Okay. Now I'm going to check your tubing to see when it was last done. So, it would have to be done within 96 hours, which it is. 96 hours is 4 days. I didn't know that until today. Alright, and then I'm going to do my 5 rights of medications, which is right patient, right med, right dose, right route, right time. And now I'm going to do my third check. 0.9% sodium chloride injection, 0.9% sodium chloride injection, 10 milliliters, 0.9% sodium chloride. Yep, so that's 3 checks, and now we're good. Now we can start with the tubing. Gonna get the tubing all opened up and undone and make sure your rolly clamp is good. Alright, so everything looks good there. Now I'm going to spike the bag. Hold it upside down so you don't spill it everywhere. I'm going to take this off and take this off. I'm going to push this on. Alright, it's all the way on. So now we're good. Now you're free to bring it back up like so. And now I'm going to hang the bag on this trusty little clothes hanger here. Ooh, my God. Next thing I'm going to do is, fill this up about halfway. And then, while making sure both of these little ports are face downward to avoid air pockets, I'm going to prime the tubing. So I'm going to put this over the garbage so I don't spill it everywhere. This part needs to be down a little bit more. Alright. Open the port. Water's going to come down. Slowly but surely through the first port. Now I'm just gonna, okay. So you do it until you're getting drips out of the bottom here. That's why you do it over the garbage. So I'm gonna flick these just to make sure, even though I can't see through to see if there's air bubbles, you still flick them just to make sure there's no air bubbles. All right, now I can close it back up for now so I don't drip water everywhere. Now I'm done with that part. I'm gonna bring this over here. Make it a little easier on myself. Now I'm gonna do the flush real quick. Get that part off. I'm gonna take this off sterilely. I'm going to unclamp this. Going to make sure there's no air bubbles. So just push it up a little bit. I'm gonna attach this sterilely. I'm gonna aspirate for blood. Good. And then I push it. You just do this real quick pulsing motion here. Nice and slow until all the 10 milliliters is in there. Now I'm just gonna leave this just to maintain sterility. It makes it a little bit easier while I grab my other tube here. Okay. I take this cap off, put this down here. Now I'm good to detach this. Okay, then you just make these kiss here, and you're good with that now. Jeez. Okay, now I'm going to talk about how many drips I need. So the doctor's order says 100 milliliters per hour, but since I have to do this manually, I have to put it down from drips per minute. So that equals, I did the math, and it equaled out to 16.7 drips per minute. Which we're not going to wait a whole minute to do that. So I'm going to split it, divide it by 4, which is 4 drops per every 15 seconds. So, in order to do that, sorry I pulled on your arm a little bit.
It's okay.
Just going to get this going right, it's nice and slow here. Like I have to get it going fast in order to slow it down, it seems like. Alright, so I'm going to slow it down. I already know that's pretty fast. And then with my second hand watch here, I'm going to count 1-ish. 1. Alright, that's already too slow. I already know that, so I'm going to speed it up just a tiny little bit. 1, no, too slow still. 1, 2, 3. I wasn't paying attention as much as I should have been there. I'll make sure one more time. 1, 2, 3. Still a little too slow. Oh my god. Sorry, this is kind of a frustrating process. I gotta start it over in 5 seconds here. I gotta keep it on the big ones or I forget. Alright. So agonizingly slow. I'm trying to get this right. I'm sorry. One, two, three, 4, and 15 seconds. Good Lord. So anyway, after that is all set up, I would label the tubing with my name, date, and time that I changed the tubing. And then I would say, is there anything else I can do for you? I have the time, and then I would document.